So what is hip revision surgery and why do hip replacements fail? Well, hip revision surgery is a second-time surgery for any reason. There's a number of different reasons that hip replacements fail. And if we look at early hip replacements, they suffered from having that older plastic. The older plastic would wear out faster, so they had to have a thicker piece of plastic. That led us to using smaller femoral heads when we would replace the hip. You know, the average femoral head is 50 to 52 millimeters, and the average hip replacement femoral head in the 70s and the 80s was 22. That smaller head would dislocate or come out of a socket more often, and so the plastic would also just wear through. As the technology has gotten better and modern plastic, which is not going to wear out as much, it has become much thinner, allowing us to put a larger femoral head in. This has decreased the risk of the ball coming out of the socket, called dislocation. And so we are certainly seeing with modern plastic, hip replacements are not failing because the plastic's wearing out any longer. Hip replacements are failing today, like we talked about in the knee, because the part's loosen for some unknown reason, because the ball comes out of the socket. Now we're knowing more about that because the spine plays a role in the hip, but we call that instability or dislocation. And then certainly we're still seeing bone breaking around the parts. And so the reason that a person is getting a second-time surgery in 2023, 2024 is vastly different than the person in 1995. Now, anybody who was, watching the news in the early 2000s heard about metal-on-metal hip replacements. And one of the ways we tried to combat that plastic wearing out was to use metal touching metal in the articulation. What was underappreciated is that it could rub on it and release metal into the body. That metal locally in the hip can cause your body to eat away muscle and bone, and then systemically it gets in your blood and can affect your thyroid or your heart or your hair or your fingernails. Obviously, metal-on-metal hip replacements have now gone away, but I still have patients who see me who have metal-on-metal hip replacements. If we look at, the news makes it seem as if every single one of those failed. But it was like a 7 to 10% failure rate. Now, that's 90% of people are still doing okay with them, but that 7 to 10% was just way too high to consider keeping those parts around. Modern hip replacements fail similarly to the knee at about 0.25 to 0.5% per year cumulative. What that means is in 20 years with the hip replacement that I put in you, is you're going to have a 5% chance of having a second-time surgery. Way lower than in 1995 or 1985 because the tools and the techniques are better in allowing us to put it where we should be putting it, but also these parts are just a whole lot better.